Imagine this: a small cut on your foot. No pain, no big deal, right? But within weeks, it turns into a wound, then infection, then amputation. And shockingly, it can increase your risk of early death. Yes, you heard that right. Today, we're exposing the deadly truth about diabetic foot. What causes it, how to prevent it, and why ignoring it could cost your life. Watch till the end. This might save your foot and your future. Diabetes is already known as a silent killer. But what many people don't realize is, one of its most dangerous complications is diabetic foot, a condition that starts silently, but can lead to chronic wounds, severe infections, amputation, and even early death. Medical studies show that people with diabetic foot ulcers have significantly higher mortality rates, sometimes comparable to major cancers. What is diabetic foot? Let's understand it simply. A diabetic foot usually refers to a wound, ulcer, or infection on the foot in a person with diabetes. These ulcers happen because of nerve damage, poor blood supply, weak immunity. According to medical research, diabetic foot ulcers develop due to a combination of peripheral neuropathy, peripheral arterial disease, infection. This combination is often called the perfect storm for foot damage. Why diabetic foot is so dangerous? Here's the scary part. Many patients don't feel pain. Why? Because diabetes damages nerves. So, you don't feel injury. You don't notice infection. You delay treatment. By the time you realize, the damage is already severe. How diabetic foot leads to early death. Now let's answer the most important question. Why does diabetic foot increase risk of early death? 1. Chronic infection. Foot ulcers can become infected easily. These infections can spread to soft tissues. Bones leads to osteomyelitis. Blood causes sepsis. Severe infections can become life-threatening. 2. Poor blood supply. Diabetes damages blood vessels. This means wounds don't heal, oxygen supply is low, tissue dies, patients may develop gangrene as dead tissue. 3. Amputation risk. When infection spreads, doctors may have no choice but to amputate. And here's a shocking fact. Mortality after major amputation is very high within 5 years. 4. Indicator of severe disease. A diabetic foot is not just a local problem. It indicates advanced diabetes, severe vascular disease, high cardiovascular risk. So many patients die from heart attacks, stroke, not just the foot problem itself. 5. Systemic inflammation. Chronic wounds trigger inflammation, immune stress. This affects the whole body. Reality check is, patients with diabetic foot ulcers often have higher hospitalization rates, longer recovery, increased mortality. This is why doctors take diabetic foot very seriously. Causes of diabetic foot. Let's break it down simply. 1. Peripheral neuropathy or nerve damage. Loss of sensation. You don't feel pain or injury. Repeated unnoticed trauma. 2. Peripheral arterial disease or poor circulation. Reduced blood flow, slow healing, tissue death. 3. Infection. People with diabetes have weak immunity. High sugar leads to bacteria growth. Foot infections are actually very common in diabetes. 4. Foot deformities, pressure points, abnormal walking, skin breakdown. 5. Poor foot care, walking barefoot, tight shoes, ignoring wounds. 6. Uncontrolled blood sugar, high glucose, damages nerves, weakens immunity, delays healing. Early warning signs of diabetic foot. Let's talk about something extremely important. Your body gives warning signs, but most people ignore them. And in diabetes, ignoring these signs can cost you your foot or even your life. So, pay close attention. 1. Dry, cracked skin, the first silent signal. This may seem harmless, but it's often the first sign of trouble. In diabetes, skin becomes dry due to nerve damage. Sweat glands stop working properly. Cracks form easily. These cracks act like open doors for bacteria. Infection can start even without a visible wound. 2. Redness, a hidden inflammation. If you notice redness on your foot, don't ignore it. It could mean pressure from tight shoes, early skin breakdown, beginning of infection. If redness doesn't disappear after rest, it's a warning sign. 3. Warmth in one area of the foot. Touch both feet. If one area feels warmer than the other, that's not normal. It may indicate inflammation, infection. Increased pressure. This is often an early sign before an ulcer forms. 4. Swelling. Your body is signaling damage. Swelling can happen due to infection, poor circulation, injury you didn't feel. Even mild swelling should not be ignored, especially if it is only in one foot. 5. Small cuts, blisters, or sores. This is where things become serious. You may notice a small cut, a blister from shoes, a tiny wound, and you think it's nothing. But in diabetes, even a small wound can become a major ulcer. Why? Healing is slow. Infection risk is high. 6. Slow healing wounds. Normally, wounds heal in a few days, but if you notice, a wound that doesn't heal within 1-2 weeks, this is a red flag. It may mean poor blood supply, infection, high blood sugar. 7. Bad smell. A strong, unpleasant smell from the foot is a danger sign. It may indicate infection, tissue breakdown, dead tissue. This requires immediate medical attention. 8. Discharge or pus. If you see yellow fluid, white pus, blood-stained discharge, this means infection is already present. Do not delay treatment. 9. Pain or no pain at all. Here's something very important. Some patients feel pain, others feel nothing. Why? Because of nerve damage. So, pain can indicate infection. No pain does not mean no problem. In fact, painless wounds are often more dangerous. 10. Skin color changes. Watch for darkening of skin, blue or purple areas, black patches. Black skin is especially dangerous. It may indicate gangrene. This is a medical emergency. 11. Thickened skin or calluses. Calluses form due to repeated pressure, poor footwear. Underneath a callus, an ulcer may already be forming. This is often missed. 12. Changes in foot shape. Over time, diabetes can cause deformities, abnormal pressure points. This increases risk of ulcers. 13. Difficulty walking or balance issues. If you notice unstable walking, weakness in feet, this may be due to nerve damage, muscle weakness. 14. Fever is a late sign. If infection spreads, you may develop fever, chills, weakness. This means the infection is becoming serious. Critical message is, here's the truth most people don't realize. Diabetic foot doesn't start with a big wound. It starts with dry skin, small cracks, mild redness, and slowly, it turns into something life-threatening. Remember this line. If you have diabetes, there is no such thing as a small foot problem. When to act? Immediately. Go to a doctor without delay if you notice a wound not healing, black or discolored skin, pus or bad smell, increasing redness or swelling, fever. So now you know the warning signs. But the real question is, can diabetic foot be prevented? Let's find out next. Types of diabetic foot ulcers. There are mainly 3 types. 1. Neuropathic foot damage type, caused by nerve damage. Key features: little or no pain, warm, dry skin. Ulcers usually on pressure areas. Patient may not notice injury. Danger: because there is no pain, wounds get ignored and worsen. 2. Ischemic foot or poor blood supply type, caused by reduced blood flow. Key features: painful foot, especially at rest or night. Cold, pale or bluish skin. Weak or absent pulses. Wounds heal very slowly. Danger: high risk of tissue death. 3. Neuroischemic foot, combination of nerve damage plus and poor circulation. Key features: may have mild or no pain, poor healing, high infection risk, most serious type. Danger: Highest risk of ulcer, infection, and amputation. Diagnosis. Doctors evaluate foot examination, sensation testing, blood flow by ultrasound Doppler, X-ray for bone infection. Treatment of diabetic foot. Treatment requires multi-step care. 1. Wound care, cleaning, dressing, moist environment. 2. Offloading, removing pressure from the wound, special footwear, bed rest. 3. Debridement, removing dead tissue. 4. Antibiotics, for infection control. 5. Blood sugar control, very important. 6. Surgery, in severe cases, drainage, revascularization, amputation. 7. Advanced therapies, skin grafts, hyperbaric oxygen, how to prevent diabetic foot. This is the most important part. Daily foot check, look for cuts, blisters, redness, wash and moisturize, keep feet clean, avoid dryness, proper footwear, comfortable shoes, no barefoot walking, nail care, trim properly, avoid injury, control blood sugar. The most powerful prevention. Regular doctor visits, especially if long-term diabetes, previous ulcers. Home care tips are: 1. Check your feet daily. Look for cuts, blisters, redness, swelling. Even small changes matter. 2. Keep feet clean. Wash feet daily with lukewarm water. Dry gently, especially between toes. Moisture can cause infection. 3. Moisturize but carefully. Apply lotion to prevent cracks. Avoid between toes can cause fungal infection. 4. Wear proper footwear. Comfortable, well-fitting shoes. Avoid tight or hard shoes. Never walk barefoot. 5. Nail care. Trim nails straight. Avoid cutting too deep. Prevents injury and infection. 6. Take care of small wounds. Clean with mild antiseptic. Cover with clean dressing. If not healing, see doctor. 7. Control blood sugar. The most important step. Good sugar control sex, better healing plus less complications. 8. Avoid risky habits. No hot water bottles, no self-cutting of corns calluses, no harsh chemicals. 9. Know when to see a doctor. Immediately if wound not healing, pus or bad smell, black or discolored skin. One-line takeaway is: daily care and early action is saving your foot. Common mistakes people make: ignoring small cuts, walking barefoot, using tight shoes, delaying doctor visit, poor diabetes control. Psychological impact is: diabetic foot effects, confidence, mobility, mental health. Amputation can lead to depression, anxiety. Let's be honest, most people think it's just a small wound, but in diabetes, there is no such thing as a small wound. When to see a doctor immediately: non-healing wound, redness spreading, fever, bad smell, black skin. Diabetic foot is preventable, treatable early, dangerous if ignored. And remember, it's not just about losing a foot. It's about losing life. If you or your family member has diabetes, start checking your feet today. And if you found this video helpful, like this video, comment foot care if you learned something new. Share it with someone who has diabetes. Subscribe for more life-saving health content. Your health is in your hands. Take care of your feet before it's too late.